Okay, good morning everybody. As Dr. Thakkar has introduced me, I am a cardiologist and practicing cardiology since almost 25, 27 years. And I have worked in India, in England, I have worked some time in US also for a few months. And all over the world I have seen there is significant rise in heart related diseases in last 25 years. Earlier we used to have patient coming in their 60s, 70s with a heart attack, but nowadays we see patient in their 30s, 40s coming with lot of heart attack. And all that rise has coincided with significant rise in obesity all over the world, significant rise in consumption of fast food and stress also. So all things which I am seeing when I see a young patient coming to me with massive heart attack, and despite everybody trying to save his life, sometimes patient lose their life, and even if we are able to save their life, then they land up with massive damage to their heart muscle, and for whole life they are basically suffering from that damaged heart, which requires a lot of medication and lot of care. So because of these things, I thought that we should start this program and should encourage people so that they can take steps in their day-to-day life and prevent all these kind of problems. So I am here to sensitize you and advise you things which you can do in your day-to-day life, simple things which you can do to prevent lots of problems related to heart disease. These are like high blood pressure, high cholesterol, obesity, metabolic syndrome, which converts into diabetes, and also heart disease. And I will talk about magnitude of problem of lifestyle related heart disease all over the world and also in UAE. What are lifestyle related heart diseases, and few words about most devastating problem, that is coronary artery disease, which causes heart attack and sudden death. And by taking few steps in life, we can prevent a lot of these problems, and we can also cut down financial cost and can add not only years to life, but also blissful quality to our life. As you can see here, all over world, these are 5 major causes of death all over world. And if you can see cardiovascular disease, that is equal to all 4 diseases. That is data from 2011, but that data has further risen. So you can see here how much is magnitude of heart disease all over world. And World Health Organization estimate that almost 70 to 80% of premature deaths are caused by lifestyle related disease. And it says that basically we are killing ourselves by our own habit, because that's what lifestyle diseases are. As you can see here, earlier in early 19th century, majority of people used to suffer, have disease or die because of invasion in their body, because of bacteria or some other thing. And you can see here the people used to die because of pneumonia, tuberculosis, gastroenteritis, diarrhea, and all these kind of things. So we have basically, with advances in science, technology, antibiotic, we have controlled all these things. But what has happened, problems with lifestyle diseases has risen, and a lot of people now dying because of heart disease, cancers, and other kind of lifestyle related diseases, lung diseases also. As you can see here now, that almost 65 to 70% problem of death is because of lifestyle related diseases. And once you see that all these problem, total mortality because of heart related problem, and what is the burden of disease, it's quite huge. So you can see here, pointer actually doesn't work, so I'm sorry. But as you can see here in white, this is all heart related disease, and this blue color indicates people who are suffering from high blood pressure. Then pink color indicates high cholesterol, and this is diabetes, which has risen further, and that is total burden of disease all over the world. So basic lifestyle diseases are high blood pressure, raised cholesterol or fat, then metabolic syndrome, which comprise of syndrome which like truncal obesity, people having lipid disorder, high blood pressure, and borderline diabetes, and then coronary artery disease, which itself present as pain in chest, sometimes with heart attack and sometimes with sudden death. And when you see all these lifestyle diseases, problem here is that symptoms occur only in few people. Like people might be carrying lot of disease, but they will come with chest pain or some other kind of problem only in around 20-30% people. So almost 70 to 80% people might be carrying significant disease like diabetes, high blood pressure, very high cholesterol, but they might not be realizing because they don't have symptom. And this basically present as that these are silent kind of lifestyle diseases. So these are like silent kind of volcano. They can erupt anytime, can cause sudden heart attack, sudden death, stroke, can cause paralysis and all that. And all this occurs because of these 6 basic problems: physical inactivity, sleep deprivation, unhealthy diet, which is very important, smoking, stress, and sometimes because of alcohol. So these 6 basic things in our lifestyle are causing all these lifestyle related diseases, which are high blood pressure, diabetes, cancer, chronic lung diseases, and also contributing huge amount to heart disease. As far as problem in UAE is concerned, you can see here almost 40% population in UAE is obese, 30% diabetic, almost 30% hypertensive, and 30%, 30% have high cholesterol. So like here in UAE, very fertile ground for all these kind of lifestyle diseases. So almost 30% population has reversible risk factors for coronary artery disease. That is Abu Dhabi Health Authority basically research which has shown in 2011. And if you have one risk factor, one problem in lifestyle, it not only causes problem with your heart, but also causes other things. Like if you are consuming tobacco, it is causing several problems. Diet, which is important, can lead to heart disease, cancer, diabetes, oral health problem, and other things. Physical inactivity, which is very, very important, can lead to all these problems. So if you have problems with lifestyles, not only it will cause heart-related disease, but it will cause other lifestyle-related problem. And in last 5-10 years, it has been very well recognized that stress is basically coming at the center of it, either contributing or directly causing a lot of these problems. As you can see here, stress itself can lead to poor diet, diabetes, lack of sleep, smoking, alcohol drinking, high blood pressure, and all that will contribute to ultimately heart-related diseases or heart disease, so that patient will have heart attack or sudden death. And as you can see here, once you have problem in lifestyle, if you have one risk factor, it has multiplier effect. It's not like people have one risk factor, 2, so just twice they have high risk. If they have 2 risk factor, then risk multiplies to 4. If they have 3 risk factor, then risk of them dying because of heart problem become 10 times. So this is very, very important to understand that if you have one risk factor, then at least try to control other things which are going wrong in your life. So what we can do about this? Almost 80% of lifestyle related diseases, including coronary artery disease, can be prevented by lifestyle changes if you start early. Once disease has occurred, then you have less chance of preventing it. But once we have intervened, like I have done angioplasty or coronary artery bypass surgery has been done, then also you will require all these lifestyle changes so that next time you don't get that disease. And if you already have disease, then lifestyle management can improve control of disease. Like if you are hypertensive, if you are on 3 medicines, if you are able to cut down your weight, reduce your alcohol intake, then instead of taking 3 medicine, you can cut down to just 1 medicine. I have series of patients who had high blood pressure, who had borderline diabetes, who had little bit of cholesterol. They were on 3-4 medicines, and after cutting down their weight, doing regular exercise, eating properly, now they are controlling everything without medicines. So that's very important. So that will reduce financial burden, and it can also delay or reduce need for any surgical intervention or non-surgical intervention, right? Angioplasty. So you should consider it like you drive car. So for safe journey, you need it proper maintenance, you keep it properly. So similarly, keep your body, heart healthy, keep it checked, and whatever you are consuming, be conscious about it, what you are doing to your body. If you are smoking, taking a lot of fast food, drinking too much of soda and all that, how it is contributing to your body. And if you're not taking care, then all this can happen. Like if you can have disease, either you will just come with chest pain, or you come with massive heart attack, or you might suddenly pop dead there. You must be hearing a lot of news about it. People are just walking and suddenly dying. So this is because if they are not taking care of their body, not taking care of their habits, then this is what happens. So take home messages. Lifestyle related heart disease emerges as new age killer. 1 in 5 men, 1 in 6 women die because of heart related disease. So this is very, very important. And majority of factors causing this rapid rise in heart related disease can be corrected by early lifestyle changes. So, what are these lifestyle related heart diseases? As I have told you, these are basic lifestyle related diseases, and these all contribute further to than coronary artery disease, which causes heart attack and sudden death. So, if you have high blood pressure, high cholesterol, metabolic syndrome, coronary artery disease, these, there are few things about which you can't do, like if you have genetic history of high blood pressure or diabetes, you can't do much about it. If male basically more predisposed to these kind of diseases, and ethnicity, like Asian population, we see a lot of Asian populations have high blood pressure, Filipinos have a lot of high blood pressure, huge number of people having diabetes, and other ethnicity like Japanese, Koreans don't have too much of heart related disease. But there are a few things which you can do to control. So, these are like modifiable risk factor. So, unhealthy diet, high blood sugar levels, if you have smoking, if you are doing smoking, if you have high blood pressure, high cholesterol, if you are not doing regular physical exercise, if you are overweight, excessive alcohol if you are having, or if you have excessive stress, sleep deprivation, all this definitely you can think about and you can control. So, I will touch upon few important things like hypertension. What is hypertension? Normal blood pressure is 120 by 80. So, anything above 140 by 90 is high blood pressure, in between is like pre-hypertensive. So, if you are in that range, then definitely lifestyle modification helps quite a lot. But even if you have high blood pressure, if you are able to cut down weight, if you are able to cut down salt intake, alcohol intake, then also you can reduce your blood pressure quite a lot. That I will show you later. And as you can see here, high blood pressure is still the most important risk factor or for death worldwide. Why? Because we have so many antihypertensive medication is still coming, but I will show you that this is like incidence in whole Middle East. You can see almost 30-40% population, all countries suffering from high blood pressure, whether male or female. Almost 1 in 3 men basically suffering from high blood pressure, and it is contributing 51% death rate because of a stroke and 45% risk of coronary artery disease, just blood pressure. And apart from it causing heart problem and stroke, it can also cause problems with kidney, problems with eye also. So, controlling blood pressure is very important. And as I am telling you, despite lot of advances in pharmacotherapy, huge number of medicines are available, but why still so much of high blood pressure related death is occurring? Because almost 60 to 70% people are not properly controlled on medication. Their blood pressure is not controlled because they just pop medicine every day, they don't get checked blood pressure properly, their blood pressure remains quite high, and that is causing lot of problems with blood pressure. So, although we have lot of measures available to control that, but still people are not paying attention, and also they are not paying attention to their lifestyle. They are very obese, still taking too much alcohol, smoking, and that is contributing to all that. So, optimum level is 120/80, and how you can basically, I can help in just giving medicine, but how you can help is basically cut down your weight, cut down too much of salt intake. Actual salt which we take regularly is not much. Salt basically comes from all the fast food which we take. So, you have to cut down that. Excessive amount of alcohol, lack of physical activity, too much stress and smoking, all that contributes to raising blood pressure. So, that needs to be controlled properly. And if you are able to control these things, then you can see here in last column how much blood pressure you can control. Like if you are physically active, almost 10 millimeter mercury reduction you can achieve. If you restrict sodium intake, 2 to 8 millimeter mercury you can reduce. Weight loss is very important. So, with 10 kg weight loss, you can reduce almost 20 millimeter of mercury. So, if you combine all these, so almost 20-30 millimeter mercury blood pressure reduction you can achieve just by lifestyle changes. Second comes high fat or high lipids in blood. So, basically cholesterol is required, each and everybody needs cholesterol or fat, but too much consumption is bad. And this cholesterol in our bloodstream comes 35% comes from consumption, and 65% is basically produced by our own body. We can't control that 65% which is coming to our body, but we can definitely control that 35% which we are consuming. So, that has to be point of focus. There are various kind of cholesterol which you must be knowing, if you read a lot of health journals and all that, in all that, trans fat in last 10 to 15 years has been found to be the most important contributor of lot of problems with heart, cancer and so many diseases. So, you can see that red arrow going up causing too much of mortality because of high consumption of trans fat. Saturated fat causes little problem. Very important to know here is polyunsaturated and monounsaturated fats are good for your health. There is a lot of discussion going on about whether fat is bad or sugar is bad. That is just for your weight control, but as far as heart is concerned, fat is really bad, especially trans fat, and if you are consuming a lot of trans fat, then it is leading to a lot of problems to your heart. And once you go to hospitals, then you get all the blood check done, you have total cholesterol and all these figures, 4 or 5 things comes. I will touch upon only 2 things which are important: LDL cholesterol, which is bad cholesterol, and HDL, which is considered as good cholesterol. So, a reduction in LDL cholesterol can reduce risk of heart disease by 1%, and elevation of HDL cholesterol can improve your chances of survival by 3%. Achieving HDL cholesterol raising is a bit difficult, but definitely exercise helps in that. And LDL cholesterol you can reduce by doing proper exercise and controlling your diet. And these are few factories basically which are causing high cholesterol, obesity and all these problems. So, try to cut down as much as possible and try to teach your children also that they should not. What is problem with healthcare now is that people are fed by food industry which pays no attention to your health, and then you are treated by health industry which pays no attention to your food, because majority of time, like as a doctor, we don't have time. We have like 7-minute, 10-minute or 15-minute slots in which we have to see patients, and we'll just ask symptoms, do physical examination, discuss about their investigations. We don't have even enough time to discuss whole things. So, that's why I thought these kind of talks are very important. And as you can see here in last 10-15 years, lot of work has been done. Public is forcing lot of governments to ban trans fat, and few countries have started since 2001, 2003. You can see Denmark, France, Hungary, all that are banning lot of trans fat, excessive salt and sugar in all these fast foods. And it has been found that almost 20,000 heart attacks can be prevented by just banning trans fat, and 7,000 deaths each year can be prevented by banning trans fat. And finally, US also woken up. So, hopefully seeing US, several other countries will wake up and then they will gradually reduce consumption of trans fat. Apart from causing heart problems, you can see here lot other problems are also caused by trans fat. And I am sure Professor Kennedy will be discussing a lot about what are basically things which contains trans fat, but in nutshell, all the fast food which you eat, biscuits, a lot of bread also contains a lot of trans fat. Then metabolic syndrome is a syndrome basically characterized by central obesity. You might be normal weight, but in Asian population especially, you see central obesity, high blood pressure, high cholesterol and borderline diabetes, or what we call insulin resistance. So, evolution of man has taken like this, but now we are at final stage, because almost 30-40% of population is becoming obese or overweight. So, seeing all these kind of pictures is basically not unseen in a lot of public places, and all these things is basically contributing. As you can see here, all these countries over period of time, incidence of overweight and obesity is rising so much, just because people are eating not eating healthy and they are not doing proper exercise. So, 1 in 3 person are basically overweight and obese. And apart from causing heart problem, obesity can cause lot of other problems like lung related problem, cancers. These are scientifically proven problems which obesity has been directly related to cause all these problems. So, controlling weight becomes very important. And if you have metabolic syndrome, then because it leads to high blood pressure, high cholesterol, vascular inflammation, it leads to high incidence of coronary artery disease or cardiovascular disease. To keep so you should keep your weight within normal range, that is like 18.5 to 25 BMI. And if you have less weight, that leads to some problems, but overweight leads to lots of problem, and anything beyond 40 is very high risk for causing lots of problem. And lot of time we are seeing like people coming with 40, 35 BMI, 40 BMI, very difficult to even take in table, difficult to do their exercise test, CT scan, or even my wife is gynecologist to conduct delivery on those 40 BMI patients. And apart from causing heart disease, increase in weight also leads to increased incidence of diabetes, high blood pressure, gallstones and coronary artery disease. So, we know what shape of things to come gradually next, because in children also we are seeing a lot of obesity. So, these are like all fertile ground for all lifestyle related problems. So, diabetes mellitus I thought I will touch upon because it is very important, especially in adult. And as you can see here, all over world these are diabetes related death occurring, and Asia, like in India, it is 1 in 4 persons suffering from diabetes in India. So, almost 25% to 30% population suffering from diabetes. And all this diabetes, there is like two types of diabetes. One is congenital, in which you can't do much about, you inherit it, but majority of 80 to 90% people suffer from acquired kind of diabetes, what we call type 2 diabetes. And as you can see here, almost 80% of that diabetes can be easily prevented or controlled by changing your diet and level of your exercise. So, if you are careful, then you can control all that diabetes. And you can see here simple little bit change in weight, how incidence of diabetes occurs. And once you cut down weight, then your blood sugar also becomes normal. Apart from causing heart problem, it can lead to stroke, it can lead to eye problem, kidney problem and lot of neuropathies. So, diabetes is very important. I am a cardiologist, so basically I will focus upon diabetes. Anybody who is above 40 years and if has diabetes, then it is considered coronary artery disease equivalent. That means diabetes and coronary artery disease above 40 years becomes two sides of same coin. So, whatever risk a person has with heart disease, similar risk a diabetic person will have. So, that has to be taken care of. Problem with diabetes is almost 30% people usually do not feel any symptom. They might be having very severe blockages, but they are blissfully unaware because their pain sensation has gone. So, don't feel any pain. And lot of diabetic patient comes with silent heart attack. When they come, we do ECG, we tell them that have you had any kind of heart attack, they will say no, but ECG is definitely showing. When we do scan, we find that lot of area of heart has already been damaged. So, that is why anybody who is above 40 has diabetes need regular checkup with cardiologist or with physicians, so that we can find out whether he is having any kind of problem. And diabetes can also lead to all these problems. It becomes more problematic for women, 8-fold rise in any kind of heart disease in women as compared to 5-fold rise in men. So, take home message, majority of these lifestyle changes can be easily prevented or corrected by your lifestyle correction. Regular assessment of high blood pressure, diabetes, cholesterol, person who are above 30-40 year age is advisable, especially in high risk population. 30 year in Asian population, Filipinos and also Egyptian, but usually like guidelines are coming above 40 year, they should have regular checkup. And as you can see here, once we find out that they are having borderline high sugar or cholesterol, if you are able to reduce weight, then you can control all this thing. You can control risk of death, blood pressure, lipid, angina and diabetes by just reducing your weight. So significant findings. And it is also important to know this Ayurvedic proverb basically, when diet is wrong, medicine is of no use. When diet is correct, medicine is of no need. It not be truly correct in current scenario, but it is very important. It provides very important message. So, if you are able to control all these risk factors, then definitely you can control lifetime risk of coronary artery disease. So, managing root cause of healthy lifestyle will help in preventing heart disease, hypertension, high cholesterol, reduce financial burden, improves quality of life. People who are not able to walk just few feet because of obesity, huffing and puffing, they can run if they are able to reduce weight, prevent recurrence of heart disease. And so, if you are able to have healthy diet, regular exercise, blood pressure control, all these 10 things, then you will have very healthy heart. Just few words about important disease, which is coronary artery disease, which is my field basically, where I intervene. So, any blockages in arteries of heart leads to angina. If it is 100% blocked, then it will lead to massive heart attack. And people who have heart attack, there is 15 to 20% of them dying suddenly. And even if they have heart attack, then 1 month risk of them dying suddenly is around 10-15%. So, it is better to prevent any kind of heart attack than to have a heart attack and then come to me. There are 3 arteries in heart which supply blood, and these 3 arteries, if they get choked, any one of these arteries can lead to heart attack. So these are important arteries, one on right side and 2 on left side. These are arteries, like you can see, blood flow should occur properly. If you have blockages, then it will lead to reduction in blood and can lead to angina. Once you have heart attack, then we have only few hours to save heart muscle. If you come very late, then lot of muscle we cannot save. So important for you to understand that initial 60 minutes to 120 minutes very, very important if anybody is having heart attack. So people who have heart attack, their heart is angry, it's crying. So basically people will be having chest pain, and people, if you have blockage in brain artery, then you will have paralytic attack and other kind of problems. And if you have blockage, red arrow which shows that, then I can intervene and I can open that artery if people are coming at proper time. Problem with coronary artery disease is only 30 to 40% people actually comes with symptom, chest pain or some kind of problem. 30-40% despite having 90% blockages, they will not have any symptoms. So when you do test, exercise test and other test, then you will be able to find out. 20-30% people are very, very unlucky. They don't aware that they have disease. They will suddenly die, and then their post-mortem will show that they had blockages in arteries. So people who have blockages, they come in various kind of scenario. You can see coming with chest pain, suddenly collapsing or dying suddenly. And if you have blockages, these are areas where you get chest pain. So anything above umbilicus, below jaw, if you are having pain, you should be careful. It's not always just left side of chest if you are having pain, especially in women because they have quite atypical symptom. People who have heart attack, apart from chest pain, they will have nausea, vomiting, sweating, and especially in female, as I have told you, lot of like somatic symptoms are there. So apart from not having chest pain, they will feeling just uneasy, anxiety, back pain, neck pain, just nausea, vomiting they might be having. So if they are high risk, then they should seek their doctor's opinion. Like management of heart disease had advanced quite a lot. So in 60s, mortality rate was almost 23%, then came down to 8 to 2%. Now we can cut down to like 4 to 7%, but 4 to 7% mortality is still there despite all the advances in medical care. So target should be to reduce. Then few words about heart attack, cardiac arrest, stroke. They are not same. Heart attack means blockage in artery. Arrest means blockage. Arrest means stoppage of heart, and stroke means you have blockage in brain's artery. And all these things, time is very, very important. For heart attack, 60 minutes to 120 minutes. But if you have cardiac arrest, initial 10 minutes are important. So that's why a lot of airports and everywhere you find that defibrillators are there. So anybody who's having heart arrest, then you need that shock within 10 minutes. Okay, so if you have blockages like this, then I can intervene and open the arteries and prevent heart attack or prevent massive damage to heart muscle and prevent life. And this is how angioplasty is done. But if blockages are multiple, then Dr. Arun usually helps. He does opens your chest and does bypass surgery. So heart attack is caused by mismatch in demand and supply. 30 to 40% people only have warning signals. 30-40% will not have any symptom. 20-30% will die suddenly if they have blockage. In women, heart attack are increasing and warning sign bit different and need to be recognized. Advances in medical science has cut down mortality because of heart attack to now 4 to 7%, but still that is happening. And survival depend on early diagnosis and treatment. With heart attack, time is matter of life and death. So if you want a healthy heart, then you need to do all these things. Basically, these are my 10 commandments. You should have a healthy diet, regular exercise, adequate blood pressure control, adequate diabetes control, adequate weight control, lipid control, smoking cessation, alcohol moderation, stress reduction, adequate sleep and moderation in salt intake, and also very important, regular checkup in high risk population, Asian, and if you have family history, if you have diabetes, then you are high risk, you should have regular checkup. So I hope this talk will encourage you to basically look at your lifestyle and make changes wherever they are needed, so that you can enjoy life's journey with happy and healthy heart. Thank you.